Welcome. In this session, we'll be discussing about the clinical trials in glaucoma. For want of a better method, the clinical trials in glaucoma have been arranged in the alphabetical order of their acronyms, and we'll start with the Ahmed Baerveldt comparison or the ABC study, which was conducted to compare the efficacy of Ahmed glaucoma valve with the Baerveldt implant in the treatment of patients with refractory glaucoma. Like most other studies in this list, the ABC study was a multi-center randomized control trial. 276 patients were randomized to an AGV group and a BGI group, and the study found that patients in the AGV group had a lower intraocular pressure in the initial few weeks as compared to patients in the BGI group. But patients in the BGI group had lower intraocular pressure as compared to patients in the AGV group at and after 1 month after the procedure. Patients in the BGI group also required less topical ocular medications as compared with patients in the AGV group 3 years following the procedure. Failure rates were similar in the two groups at 5 years following the procedure, and failure was defined by the criteria given here, in which we may note intraocular pressure less than 5 mm of mercury was also a criterion for failure, which we will also find in other studies comparing surgical procedures. Serious complications defined as loss of 2 or more lines of Snellen visual acuity or need for reoperation were less common in the AGV group as compared with the BGI group. The Advanced Glaucoma Intervention Study or the AGIS was conducted to compare the effectiveness of two treatment sequences in medically uncontrolled open-angle glaucoma patients. In the first sequence, trabeculoplasty was done first, followed by trabeculectomy if the trabeculoplasty failed, following which another trabeculectomy was done if the initial trabeculectomy failed, and this was known as the ATT sequence. In the second sequence, trabeculectomy was performed first, and if this trabeculectomy failed, trabeculoplasty was done, and if that too failed, trabeculectomy was repeated, and this was known as the TAT sequence. 789 eyes of 591 patients with medically uncontrolled open-angle glaucoma were randomized to either the ATT sequence or the TAT sequence, and the AGIS found that black patients had a lower rate of progression of visual field defects with the ATT sequence, in which trabeculoplasty was performed first as compared with the TAT sequence. On the other hand, white patients had a lower rate of progression of visual field defects with the TAT sequence, in which trabeculectomy was performed first as compared with the ATT sequence. The AGIS also showed that assessment of optic nerve findings showed good inter-observer correlation but poor inter-observer correlation. Risk factors found in AGIS to reduce effectiveness of argon laser trabeculoplasty included young age and higher baseline intraocular pressure, and risk factors found in AGIS to reduce effectiveness of trabeculectomy included young age, higher baseline intraocular pressure, and diabetes mellitus. The AGIS also found that intraocular pressure fluctuation was an independent risk factor for progression of open-angle glaucoma in patients with lower baseline intraocular pressure but not in patients with higher baseline intraocular pressure. The Ahmed versus Baerveldt or the ABV study was similar to the ABC study in that it compared the efficacy of the Ahmed glaucoma valve with the efficacy of the Baerveldt implant in the treatment of patients having medically uncontrolled glaucoma with or without a prior failed trabeculectomy. 238 patients were randomized to an AGV group or to an BGI group. The AVB study found that patients in the AGV group had a lower intraocular pressure in the initial few weeks as compared to patients in the BGI group, and patients in the BGI group had lower intraocular pressure as compared to patients in the AGV group at and 1 month following the procedure. Also, patients in the BGI group required less topical ocular medications as compared with patients in AGV group at 5 years following the procedure. So these three findings in the AVB study were similar to those of the ABC study, but the AVB study found that failure rates were lower in the BGI group as compared to that in the AGV group at 5 years of follow-up, and also that at 3 years of follow-up, hypoton-related vision-threatening complications occurred in the BGI group but were not found to occur in the AGV group. The Collaborative Initial Glaucoma Treatment Study, or the CIGTS, was conducted to determine whether patients with newly diagnosed open-angle glaucoma, including primary open-angle glaucoma, pseudoexfoliation glaucoma, and pigmentary glaucoma, are better treated initially with medicines or trabeculectomy surgery. 607 open-angle glaucoma patients were randomized to an initial medical therapy group and an initial surgical therapy group, and the study found that initial medical therapy group and the initial surgical therapy group both have the same visual field outcomes after 9 years of follow-up. But average intraocular pressure was lower in the initial surgical therapy group as compared with initial medical therapy group. The CIGTS also found that IOP fluctuation was a risk factor in progression of glaucoma in the initial medical therapy group but not in the initial surgical therapy group. The CIGTS also found that patients with worse baseline visual field status had less progression with initial surgical therapy as compared to initial medical therapy. Also, early visual loss was more frequent in the initial surgical therapy group, with the difference in the visual acuity loss between the two groups decreasing over time. The CIGTS also found that visual field of patients with diabetes were more likely to worsen with initial surgical therapy as compared to initial medical therapy. The Collaborative Normal Tension Glaucoma Study, or the CNTGS, was conducted to determine the role of IOP lowering to prevent progression of normal tension glaucoma. Normal tension glaucoma, as defined in this study, were patients with progressing visual field defects or optic disc changes, but with intraocular pressure never found to be going above 24 mm of mercury on repeated testing. 140 eyes of 140 patients with normal tension glaucoma were randomized to an observation group and a treatment group, and in the treatment group, IOP was lowered by at least 30% with either topical ocular hypotensives, laser trabeculoplasty, or surgery. The CNTGS found that NTG patients in the treatment group experienced further progression less often as compared with NTG patients in the observation group. The compared study was conducted to compare the efficacy of the Hydrus microstent with the efficacy of the iStent as standalone treatment in open-angle glaucoma. 152 eyes were randomized to a Hydrus microstent group and an iStent group, and the study found that more patients had complete success in the Hydrus microstent group as compared with patients in the iStent group. Complete success was defined as achieving an intraocular pressure of 18 mm of mercury or less without any necessity for topical ocular hypotensives or any further surgical procedures. The safety profile of both the devices were found to be similar. The EAGLE study was conducted to compare the effectiveness of clear lens extraction with that of standard care in patients with primary angle closure or primary angle closure glaucoma. Standard care in PSC or PSCG was considered to be laser peripheral iridotomy with or without medications. 419 patients without visually significant cataracts were randomized to a clear lens extraction group and a standard care group. Clear lens extraction resulted in a lower intraocular pressure, better quality of life, and improved cost effectiveness of treatment as compared with standard care. Irreversible loss of vision occurred in one patient in the CLE group and 3 patients in the standard care group, and the study concluded that clear lens extraction can be an initial treatment option for primary angle closure or primary angle closure glaucoma, and that in comparison to LPI, clear lens extraction may maintain its efficacy in the long term. The European Glaucoma Prevention Study, or the EGPS, was conducted to evaluate the efficacy of dorzolamide to prevent or delay conversion of ocular hypertension patients to primary open-angle glaucoma. 1081 ocular hypertension patients were randomized to a dorzolamide group and a placebo group, and the average follow-up was almost 5 years. EGPS study failed to show efficacy of dorzolamide to prevent or delay progression of ocular hypertension to primary open-angle glaucoma, and several reasons had been forwarded to explain the failure. The early manifest glaucoma trial or EMGT was conducted to evaluate the efficacy of IOP lowering in newly diagnosed open-angle glaucoma patients with early glaucomatous changes, and patients included had mean deviation higher or better than -15 decibels, average intraocular pressure of 30 millimeters of mercury or less, without intraocular pressure ever being recorded above 35 millimeters of mercury. The EMGT was a single-center randomized controlled trial conducted in Sweden. 255 patients were randomized to an observation group and a treatment group, and the treatment group received either betaxolol or argon laser trabeculoplasty. In the EMGT, average intraocular pressure reduction in the treatment group was 25%. The EMGT found that after 6 years of follow-up, 62% of patients in the observation group and 45% of patients in the treatment group showed evidence of progression. It also found that every millimeter of mercury reduction of intraocular pressure from the baseline reduced the risk of progression by 10%. On multivariate analysis, risk factors identified to promote progression of glaucoma included older age, bilateral disease, pseudoexfoliation syndrome, higher baseline intraocular pressure, worse mean deviation on perimetry, and frequent disc hemorrhages. The glaucoma laser treatment or the GLT trial attempted to evaluate the efficacy of argon laser trabeculoplasty as compared with the efficacy of topical timolol as initial treatment of newly diagnosed primary open-angle glaucoma patients. 271 primary open-angle glaucoma patients were enrolled, and in each patient one eye was randomized to the argon laser trabeculoplasty group and the other eye to the timolol group, and the study found no significant difference in efficacy of the two treatments. However, argon laser trabeculoplasty achieved a lower intraocular pressure and better preservation of the visual field after 7 years of follow-up, although the difference between the two groups were not significant. One limitation of the study was timolol application in one eye, which is known to have an IOP lowering effect in the contralateral eye also. The Horizon study attempted to evaluate the effect of hydrous microstent along with cataract surgery in patients with cataract and primary open-angle glaucoma having an intraocular pressure between 23 and 34 millimeters of mercury and without any history of any previous incisional ocular surgery. Horizon study randomized the patient 2:1 into two groups so that 369 eyes underwent hydrous microstent implantation along with cataract surgery in the HMS group and 187 eyes received cataract surgery only in the CS group, and the study found that more patients in the HMS group as compared to patients in the CS group achieved intraocular pressure of 18 millimeters of mercury or less and an IOP reduction of 20% or more. Also, less patients in the HMS group required incisional surgery during follow-up as compared to patients in the CS group. However, there was no difference in the rate of endothelial cell loss between the two groups. The Lasers in Glaucoma and Ocular Hypertension trial or LIGHT was conducted to compare the effectiveness of selective laser trabeculoplasty with that of topical medications as the initial therapy for ocular hypertension and primary open-angle glaucoma. 718 patients were randomized to an initial SLT group and an initial medication group, and the study found no significant difference between the two groups with regard to quality of life, intraocular pressure achieved, and visual acuity preservation. But patients in the SLT group had a lower rate of disease progression as well as a lower need for incisional surgery as compared with patients in the medication group, and SLT was found to be more cost effective as compared with medications. In low tension glaucoma treatment study or LoGTS, efficacy of brimonidine was compared with that of timolol in the treatment of normal tension glaucoma patients to explore the purported neuroprotective effect of brimonidine in addition to its IOP lowering effect. 199 NTG patients were randomized to a brimonidine group and a timolol group, and the study found that brimonidine and timolol had similar IOP lowering efficacy, but fewer patients on brimonidine had visual field progression as compared with patients on timolol. Also, brimonidine was found to cause ocular and systemic adverse effects more frequently. The ocular hypertension treatment study, or OHTS, is a very important study which we have discussed extensively in the session on ocular hypertension. The OHTS was conducted to evaluate the safety and efficacy of topical ocular hypotensive therapy in patients with ocular hypertension to prevent or delay their progression to primary open-angle glaucoma. 1,637 ocular hypertension patients were randomized to an observation group and a treatment group, and in the result published in 2002, the OHTS reported that ocular hypertension patients in the treatment group progressed less frequently to primary open-angle glaucoma as compared to ocular hypertension patients in the observation group, and there was no increase in adverse events when ocular hypertension patients were treated with anti-glaucoma medications. Risk factors found to promote progression to primary open-angle glaucoma included older age, higher intraocular pressure, larger cup-disc ratio, lower central corneal thickness, and higher pattern standard deviation on visual field analysis. After 7.5 years since the initiation of the study, patients initially in the observation group were started on ocular hypotensive agents for another 5.5 years, and the ocular hypertension patients initially in the treatment group were made to continue their treatment. And in the result published in 2010, OHTS reported that after 13 years from the initiation of the study, 22% of patients initially in the observation group and 16% of patients initially in the treatment group progressed to primary open-angle glaucoma. And it concluded that delayed initiation of treatment is equally efficacious in decreasing the rate of progression of glaucoma. The United Kingdom Glaucoma Treatment Study, or the UKGTS, attempted to evaluate the efficacy of latanoprost in preventing the progression of treatment-naive open-angle glaucoma. One important characteristic of this study was that the study could be completed in a short period of 2 years by clustering several visual field tests at the beginning and at the end of the study. 516 open-angle glaucoma patients were randomized to a latanoprost group and a placebo group, and the study found that patients in the latanoprost group showed a lower progression rate as compared with patients in the placebo group. The tube versus trabeculectomy study, or the TVT study, attempted to compare the efficacy of trabeculectomy with mitomycin C with that of Baerveldt tube shunt surgery in patients with uncontrolled glaucoma after a previous trabeculectomy and or cataract surgery with IOL implantation. 212 eyes were randomized to a trabeculectomy group and a tube shunt group. The study found that mean intraocular pressure, number of glaucoma medications, quality of life, and complete success rate were similar in the two groups. Complete success was defined as stabilization of visual field defects without the need for additional medications, but failure rate was higher in the trabeculectomy group as compared with the tube shunt group. Also, patients in the tube shunt group required fewer post-operative clinic interventions as compared with those in the trabeculectomy group. And overall, 40% of patients lost 2 or more lines of visual acuity with no significant difference between the two groups. In the primary tube versus trabeculectomy study, or the PTVT study, efficacy of trabeculectomy with mitomycin C was compared with efficacy of Baerveldt tube shunt surgery in patients with medically uncontrolled glaucoma who did not have any previous intraocular surgery. 242 eyes were randomized into a trabeculectomy group and a tube shunt group. The PTVT study found that mean intraocular pressure was significantly lower in the trabeculectomy group as compared with the tube shunt group at 1 year and 3 years of follow-up, but the mean IOP were similar in the two groups at 5 years of follow-up. In the PTVT study, the difference in the failure rates between the two groups were not statistically significant, but patients in the tube shunt group required significantly more anti-glaucoma medications. The PTVT study found that rates of loss of visual acuity and reoperation were similar in the two groups. The Zhongshan angle closure prevention study, or the ZAP study, was conducted to evaluate the role of laser peripheral iridotomy in primary angle closure suspect patients to prevent progression to primary angle closure glaucoma, and acute angle closure. Patients with bilateral PACS were included, and the two eyes of each patient were randomized so that one eye received LPI and the other eye did not. After 14 years of follow-up, 499 LPI treated eyes and 497 control eyes continued follow-up. The ZAP study found that in the LPI group, 30 eyes or 6% of eyes with PACS converted to PAC, 2 eyes progressed to PACG, and 1 eye had attack of acute angle closure. In the control group, 96 eyes or 19% of eyes with PACS converted to PAC, 4 eyes progressed to PACG, and 5 eyes had attack of acute angle closure. The ZAP study concluded that laser peripheral iridotomy is not required for all PACS patients. Need for treatment should be determined by degree of narrowness of the angle, occurrence of symptoms, and patient's preferences. Thank you for listening.